The following is an archived interview originally conducted by Julius Chatton. This interview was aired on KFCF 88.1FM, Free Speech Radio for Central California. For more details, please visit kfcf.org.
Yes, it's a pleasure for me to have Dr. Lynn Keenan on the show this evening. I met an associate or a colleague of hers at a local coffee shop, and we just got to talking about what each other did, and, she exchanged some sleep disorder information with me that I thought would be very interesting for tonight's show. So I don't know if we have Dr. Keenan on the line.
Did you say sleep disorder?
Sleep disorder, yes.
Sleep disorder, okay.
Yeah.
We can all sleep good tonight after we hear this.
Hopefully, yes. Dr. Keenan, are you there with us?
Yes, I am.
Great.
Thank you.
Good to hear you. So, yes, I have some questions lined up for you. I just wanted to open the discussion about sleeping disorders because it's something that a lot of people suffer from, and I don't know how many people go undiagnosed or what have you. But I guess my first question is, how many years have you specialized in the area of sleep disorders?
I've been doing sleep medicine since about 1993, so about 18 years.
That's wonderful. And so is that about how long your practice has existed? Or exactly what is your practice?
Well, actually, I joined the practice. It was initially called the Pulmonary and Sleep Disorders Center, and it was the first sleep center in Fresno County. And now we've changed the name a number of years back. It's now called University North Medical Specialty Center.
Great.
I'm also an internist, so I'm board certified in both medicine and internal medicine.
That's wonderful. So let's see. Would you consider a sleeping disorder to be a medical condition?
Well, it certainly can be. I mean, there's a number of really fascinating sleep disorders. But then there's also kind of the run-of-the-mill, like insomnia, that I think just about everybody's experienced at some point in their life. And I wouldn't consider that it's a sleep disturbance, but maybe not a medical condition. But there's other ones, like narcolepsy and sleep apnea that certainly are.
Okay. So, and we're talking about all these different variations of sleep disorders. I mean, on an average, how many people do you think, or how many Americans, what percentage of Americans, I would say, would suffer from sleep disorders?
If you're looking at the more serious ones, like sleep apnea, again, and narcolepsy, that's probably around 10 to 15%. But if you throw in the people also that are suffering from insomnia and chronic insomnia, then you're getting a little bit closer to 40 to 50%.
Wow. That seems like a good number of Americans.
And again, the insomnia would be, those who've had some of the occasional restless night sleep and difficulty sleeping a few times a week.
I see. So now, one of the big questions for me, does a person's physical environment influence the amount of sleep they get each night? And when I say physical environment, I would mean the air quality, the amount of noise pollution in your environment. All these factors, do they play a role in sleep disorders?
Oh, definitely. And so there's a lot of things that we can do to make our sleep environment, a little more restful. One of the big changes in society is the introduction of a lot more light, when computer screens and cell phones and clock radios that show the light, because that kind of blocks the melatonin, that's the natural hormone that helps us fall asleep. So that's probably one of the biggest things. And, of course, it depends on where you're living. Noise can certainly also have a big play on it as well. And then things from the comfort of the mattress, and the pillow has somewhat of an effect, and temperature as well. Because we fall asleep, in a 24 hours, our temperature curve kind of goes up to a peak about an hour or so before we're going to fall asleep. And as the temperature is kind of crashing down to our lowest temperature of the 24 hours, that's when we fall asleep the easiest. So if you go from a hot environment, like a hot shower, into a cool room, kind of helps you fall asleep.
Oh, I understand. So, and I've heard people who are do special orders on mattresses for height and weight variations just to get the perfect night of sleep. And I've also heard the thing about the light, because I've been known many nights to fall asleep with my computer on and, right there in the bed. And I know it's a big no-no, but I've been known to do it, just work until I fall asleep.
I think lots of college students probably have done that.
Yes. I believe Willow has a question for you.
Doctor, I have a question. Now, all my life I worked in restaurants, getting off at 12 o'clock at night and things. Would you say that over the years of me doing that, because I have a sleep disorder, would that contribute to my sleep disorder because of all the years, like 20, 25, 30 years, getting off work at 12 o'clock and getting to bed around 3 or 4, and now I can't it seems like I can't even go to sleep by 9:30, 10 o'clock anymore.
It can change the circadian rhythm, and there's some ways to kind of change that back. Just like if you were to move to another country, eventually you would kind of get into sync. And so sometimes there's some underlying sleep disorders that can keep people in kind of an odd sleep cycle, and it's really only a problem if it doesn't match kind of the social situation. If you have to get up at 8, then it's a problem. But if you stay in the restaurant work and that's where your job and your life kind of revolves around, again, then we wouldn't view it as much of a sleep disorder. But again, there's some ways like playing with the food and light sets our internal clock the most. And so trying to limit the bright light before you go to bed, sometimes taking some melatonin, and then in the morning using a bright light, like half an hour of sunshine, will help reset your clock to more of the pattern that maybe be more preferable for you.
Oh, that sounds good.
Involving sleep disorders in college students, are they a common issue for college students?
Oh, well, I think most college students don't keep a regular time in bed and time awake. Of course, I have 4 college students my children are all in college, so they thought I shouldn't talk about telling people to go to bed on time. So I wouldn't stress that too much. But, I think there's so many people would cram before a test, or stay up late, or whether it's social. And the important thing is that you give yourself some time to make up for it. So sleep in on the weekends, or take a nap when you're tired to kind of listen to your body. But in general, if you try to keep kind of the same time in bed and time awake, with just a little variation in there for, life, that's usually a good idea.
I used to see students, and occasionally I'll see students in my class that's sleeping, literally dozing off. And one point I used to think, are they that bored? Am I that much of a boring instructor? But then I realized that they literally are zoning out. It has nothing to do with, we could stand on the desks and, make all kind of noises. They'd be just zoned out. And I'm suspecting that, again, they have their own sleep disorder, and they don't have an order to their sleep. And they're coming into class, and the moment the body finds a sense of rest, that's when the sleep hits them.
Yeah, and so... And so would you consider that to be something that, the colleges should take into consideration, people who are suffering from sleep disorders? Because we have disabled services for students, but we never really talk about sleeping disorders. And for some of the more serious sleeping disorders, is it something that the colleges should really be paying attention to, making accommodations for?
Accommodations.
Well, I'm not saying set up a bed in class, but at the same time, just to have a little bit more empathy, because there's a lot of people who are suffering from sleep disorders, and for narcolepsy, for instance, is something
if it's a bona fide sleep disorder where it's truly out of their control, I'm not sure if you need accommodations if they were just out way too late the night before and think that they could catch up on their sleep during the classes.
Okay.
But if it's someone who's consistently falling asleep, I think it would be a service to them to have them checked out, because a lot of times the average person with narcolepsy will go 10 years before it's actually diagnosed after the time that they start their symptoms, just because everyone blames it on, they're just not sleeping enough. And then certainly sleep apnea is growing in prevalence in the United States with added obesity, although a third of the people will be normal weight. But that's a serious sleep disorder, so that sometimes maybe that nudge of having them, be checked out would make such a difference in just their whole, lifetime career, because it's so hard to learn when you're really tired, especially when it's, out of their control. But if you treat it early, it can make such a difference in their life.
Right. And I think in all seriousness, as an instructor, if I saw someone and I saw this as a pattern, it would be my responsibility, should be my responsibility to at least find out what's going on with the student. And if it has nothing to do with this kind of wild lifestyle, but in fact there is something going on, it does make it where it becomes the responsibility to say, maybe we need to have you go see our psychological services, or one of our services on the campus to better assist them in that area.
Well, I wanted to, elaborate a little bit more on some of the long-term effects of sleeping disorders. Aside from the obvious lack of sleep, are there any other symptoms that can develop, physical ailments, what have you, from a sleeping disorder?
Well, just looking at the amount of sleep somebody gets, they've done some long-term mortality studies that if men get chronically less than 6.5 hours of sleep, they don't live as long. For women, we need a little bit more beauty sleep. Our cutoff seems to be about 7 hours. If we get less than 7 hours, we have more heart attacks and death. So there's that big factor. But also,
yeah, I think Willow is shocked here.
Yeah, definitely so.
And then going on, I guess, other symptoms. I think most people know when you're around somebody that's sleep deprived, they get a little cranky.
Oh, yeah.
They
That's
can
so
have
true.
And I think everybody has realized that, but sometimes we don't know they're sleep deprived, so it's good to be kind of patient. But, it changes memory. For college students, it makes it harder to learn, especially the rapid memory and the recall. It's that type of memory, walk in the room, forget what you went in there for, that becomes more frequent with sleep deprivation, kind of both acute and chronic sleep deprivation. But it's also, if you're chronically sleep deprived, like less than 6 hours, it changes the immune system. So you're more likely to, get all the colds and viruses that are kind of, going around. But also, with one of the big epidemics in the United States of obesity, it tends to make people gain weight if they're not getting enough sleep, especially if their sleep is interrupted a lot. It makes the body not use insulin as well, and so it makes people a little bit more prone to diabetes and gaining weight.
There's a lot of information. Wow.
Yeah.
Wow, wait. Boy, am I learning something tonight myself.
Yes. And so, what are the sleeping disorder treatments? What's available, especially for the busy college student?
If it's kind of just poor sleep habits and not getting enough sleep, there's a website that I think is probably the best one out there. It's called the National Sleep Foundation. And it's a wealth of information. So we'll have all the ways to, have the good sleep habits so, they can tell you to go to bed on time instead of me. But if it's a sleep disorder like, sleep apnea, we have the loud snoring and then the pauses and the gasping, that is definitely better to have that diagnosed formally so that you can get the right treatment. Because definitely if you have sleep apnea, it's not treated, there's more heart attacks and strokes and many more traffic accidents as well, of course. And so or especially like in the dorm, that might be where it's picked up. A lot of my patients will come after they've been on a camping trip with friends where they've got that loud snoring and the pauses and the gasping and tired during the day and morning headaches. So again, that should be diagnosed formally. And that's what Teresa, who you met at Starbucks, that's what she does. She's my night tech, so she runs those sleep studies at night. And she's terrific, as well as I've just got a great crew of night shift workers who love what they do. And so that's sleeping at night in the lab, and where they monitor the breathing patterns and the brain waves and the body movements on the legs and the oxygen. And so we can tell if they're holding their breath, how long, how often. And then the treatments really vary depending on how bad the sleep apnea is. If it's moderate to severe, so if they're holding their breath more than 15 times per hour, then the recommended treatment is the positive airway pressure. Many people have seen people with a CPAP mask. It's like a personal fan, blows air in through the mouth and the nose and keeps that airway open. But if
that's
it's
not sexy.
Not a turn on for the
Not
bedroom.
a turn on whatsoever. Go ahead. I had to throw that party.
But on the flip side, on that note, is if people have sleep apnea, their sex drive goes way down.
Oh,
and that's
see?
one of the first
I knew there was a connection.
It's one of the first things that bounces right back. So getting it treated is a good thing.
That's an incentive, listening audience. Go get yourself checked out. If you have sex drive issues, this might be the cause.
Yes.
Hey, doctor, I got a question for you. Now, if you're basically an ex-addict, and been on, your cocaine was your drug or methamphetamine, I know that does something to you as far as, trying to get back to sleep, get into a regular pattern after 20, 30 years of doing something, because I noticed that psychiatrists always ask, did you ever do cocaine or you ever do meth or whatever? So what's a good treatment for something like that? if you have a problem sleeping, and what have you found that'll help besides taking 600, 800 milligrams of Seroquel or something like that?
So if it's mostly insomnia, because a lot of times coming off the drugs will have or alcohol, very broken up, not good quality sleep, especially for the first 6 months. So part of it is just people hanging in there. Sometimes it's related, because usually with that comes not a very good lifestyle in terms of what people are eating. So sometimes it's vitamin deficiencies that can lead to restless leg syndrome. And restless leg syndrome is the syndrome where you get a strange feeling in your legs, sometimes in the arms, where you feel like you just have to move. You can't sleep in one position because you're tossing and turning all night, or you're wiggling your foot, or you're getting up and pacing. And sometimes that is a little bit more common in people who previously treated their bodies kind of hard. And so sometimes just having that checked out, because things like iron deficiency, vitamin B12, or vitamin D deficiency can lead to that. And so finding that out and replacing it can do a lot of good. Sometimes just over-the-counter, a magnesium and a vitamin E pill that, again, you can just get right over the counter, does quite a bit of good. So if people have that restless, they can start there. But if that doesn't work, then there's certainly stronger medications. Or, again, it's always good to kind of look for some nutrient deficiencies that may be kind of the root cause. But otherwise, it's kind of trying to reestablish a rhythm in the body, and that's kind of a lot of those sleep habits of trying to keep the room dark, keep the same times that you go to bed and that you wake up, bright light in the morning, avoiding the caffeine after, say noon or so. Those things can help too.
So as far as, getting treatment for any type of long-standing sleep disorder with medication, is there any risk for medications? Is there an increased risk for college students? Because I hear a lot of commercials that say, this may be more hazardous for young adults, people under the age of 25, I should say. What are the risks for people, under the age of 25 versus someone who's middle-aged?
It's a good question, because most sleep disorders we don't treat with pills. And so it's really more lifestyle changes, or getting them, breathing better one way or another, whether it's CPAP or a dental device or just staying on their sides. So it's actually because, again, most of them are not on medications, you don't have that accumulating where you're thinking that you're balancing the risk versus benefit. And then sleep deprivation can actually, again, it can lead to poor grades and worse career outcomes and worse relationships from the moodiness. So I think there's a lot to lose. And, so much to be gained.
Yes,
so it's some of the, narcolepsy is definitely something that we usually treat with medicine. But they are doing, there's a lot of long-term studies that have been done or in the process of doing, and it still looks, like the safety profile is still really good with the medications that we use for narcolepsy.
Wow, okay. So would you like to share some of your clinic's contact information for anyone who feels that they may need diagnoses or treatment for a sleeping disorder?
Okay, so it's University North Medical Specialty Center, and it's on Fresno Street. It's 6311 North Fresno Street, Suite 104, and the phone number is 559-435-4700. We'd be happy to see anybody.
Great. Thank you so much for coming on.
Thank you for listening to this archived interview originally broadcast on KFCF 88.1 FM. For more information on free speech radio in Central California, visit kfcf.org. This has been a Julius Chatton production.